Cool. That filled up fast. That's so exciting. I think you guys are really going to enjoy what these panelists have to say today. They both have some really great perspectives on paths after school, whether that's medical school or not, or something else. And that is going to get uploaded to the College of Health Solutions YouTube page. And so we'll make sure we get that out to your CHS 101 facilitators, and they can get those to you pretty easy. You can also always email me. I'm really easy to get a hold of. Okay. Cool. Oh, well, now I can hear myself as we're being live streamed. All right, well, great. We'll go ahead and get started. Thanks everyone for joining us. We're super excited to be able to share with you guys what life looks like after school. So I know most of you are just starting your journey as a Sun Devil, but there is so much in store for you. And these awesome panelists have learned a lot and are ready to share that information with you. So I'll just start by introducing myself. My name's Katie. I am the alumni coordinator for the College of Health Solutions. So what that means is I connect with alumni in a variety of ways and make sure that they get to stay connected to the CHS family after they graduated. It's a newer program that we're just starting, so you guys are part of that as well, everyone watching here. Just want to let you know about something exciting we have going on next week. So on October 29th, which I'll send this out to you guys as well, at 6:30, we're doing a panel about healthcare disparities in the Black community, and specifically about the experience of Black healthcare providers, and that is a panel of all Black CHS alumni. So it's gonna be really exciting. We'll definitely encourage you to check out College of Health Solutions social media to get the registration link for that. But without further ado, we know that you guys are gonna have lots of questions, so I wanna make sure we get to those. I'm gonna have our panelists introduce ourselves. So Megan, if you wanna start, because I know you gotta shut your video off. She's going to be with us in audio spirit, but you can start, and then Christy, you can go right after her.
Hi, everybody. My name is Megan. I am an ASU Biomedical Informatics undergrad alum, as well as the ASU Biomedical Informatics 4+1 program. So I completed my bachelor's and my master's degree at ASU. I finished up my master's actually just last May in 2019. I recently was on a Fulbright scholarship teaching English in Malaysia as a secondary school that was ended early due to the pandemic. Specifically as an undergrad, I focused on public health and clinical health informatics with a focus on healthcare disparities, as Katie was mentioning earlier about the presentation later. And then specifically, I completed all of the pre-med curriculum, took the MCAT, did everything else, but decided to wait to apply to medical school in recognizing that there's a lot of other options other than just being pre-med and going to medical school. And Christy can talk about the other experiences being on the flip side, going through the process. So as Katie mentioned, I'm going to turn my video off, but my audio is here if you guys have questions, and I'll be listening to you throughout the whole panel.
Awesome. Hi guys, I am Christy Thomas. I graduated with my bachelor's in medical studies in 2018, and then did my master's in science of healthcare delivery and finished that in 2019. And I am in medical school at Liberty University's College of Osteopathic Medicine in Virginia. And yeah, I was also part of Barrett Honors College as well. Loved ASU a lot and did a lot with it. And yeah, I'm excited to answer your questions today.
That's so great. I think we have two really unique perspectives here on kind of that journey to figure out what it means to pursue solutions for health. So we'll just kind of start there. Kind of a big, broad question, but I want to mention too, feel free to pop questions in the Q&A. Feel free to pop questions in the YouTube stream chat. We'll be keeping our eye on those so we can answer those. But Christy, we are the College of Health Solutions. What health solution do you want to be a part of?
Ooh, that's a good question. I think one of the main things I've been really passionate about is health disparities ever since I took a class with Professor Reddy. I don't know if you guys have heard of her. She teaches this health disparities course, and it was part of the medical studies major in my bachelor's degree. And it was just so eye-opening to me to see how simple things like a zip code could affect your health so much. Like the age gap was like almost 10 years of a difference in life expectancy just because and you could see that pattern just because of a zip code. And that just blew my mind. And I had never been aware of that at all. And so then I decided like, oh, yep, I want to help change that somehow. And so then I just got involved more in social determinants of health. I did my thesis on the impact of social determinants of health on specific populations. I focused on those experiencing homelessness because I was part of Student Health Outreach for Wellness show. I don't know if you guys have heard of that as well. Great organization. But I was heavily involved in that club. So then I really got involved in like, how do these little factors like your environment or the way you grew up or your zip code, just little things like that, and how it really impacts your health. And I want to be a part of really changing that for future people, especially I want to go into pediatrics specifically. So I would love to help really see that impact of social determinants of health on children. There's this thing called adverse childhood events, which help look at the ways that things like the way a child grows up and how that impacts their overall health as well. So I want to look into that in my future career and see how I can just help kids have better outcomes in their health and not let things like a zip code be a detriment to them. So yeah.
Yeah, that's awesome. That's really cool how you also were able to combine what you were doing in school with student organizations that you were a part of. That's awesome. That Christy and I were talking about this earlier, you have such little time, or it can feel like you don't have very much time. It's really about choosing those priorities of what are going to be those things that fulfill you. Megan, you want to talk a little bit about health solutions you want to be a part of? I know you're kind of in a similar stream.
Yeah, absolutely. So I was also super interested in healthcare disparities. So specifically, I worked as a scribe in my local rural emergency center. So I'm from a small town in northern Arizona. I actually would commute home during my fourth year of undergrad and my master's year. So it was about 4 hours each way would commute home actually to serve in that population because it's severely underserved. The population is more uneducated, lower income. And specifically, I noticed very similar things that Christy talked about is how your zip code could really impact your health and the healthcare that you receive. And more specifically, I was interested in the overutilization and underutilization of resources. So specifically, people who are on insurance or on government assisted insurance, how they may not have access to the same primary care doctors, but they would overutilize the emergency departments for care because they weren't able to go to a primary care doctor, or they didn't even know how to access a primary care doctor, and how people had access to resources but didn't use them appropriately. So specifically with the informatics background that I had, in addition to my Barrett thesis, I did it on an R01 grant with the National Institutes of Mental Health, specifically looking at access of care for behavioral health patients, is how do we mitigate that everybody who is in our healthcare system actually receives care equitably, and that the care that they're getting is the best care for them at that point of the care process. So more of a kind of data analytics standpoint is where I'm interested in, but how do we combine actual providers who are in the field serving future healthcare professionals like Christy who are going to be treating these patients, but how do we also ensure that they are giving care, the best care that they can for the populations that they're giving, from more of the analytics or informatics standpoint.
Really, I love what Megan has to say there too, combined with what Christy's saying, is it really takes all aspects of health to make sure that we're serving patients and the community most effectively. I think there's really something kind of for everyone who wants to make sure that our world is a healthier place. So Anna brings up a really good question in the chat, and which I think kind of has to go with this. And so she asks, what are some characteristics do you think a person who's pursuing a career in a health field needs to have? Christy, you want to start?
Sure. That's a great question. I think definitely the first thing that came into my mind is lifelong learner, because our world is just changing so quickly, and it's just wild to see like the things I was learning in undergrad versus the things I was learning in my master's program. For example, things like the Affordable Care Act. I was learning about it and like how it was developing in undergrad, and then I was seeing it like in full-fledged motion in my master's program. And then just while I was in medical school, there was a whole debate on whether to repeal it or not, and there was like a Supreme Court case about it. And I'm like looking at it, I'm like, wait, oh, I was just learning that, and now it changed again, and now it changed again. And so just constantly seeing this evolving, it's like, oh, I have to keep up with it, you know? And so you can't just be like, oh, I'm okay with how much information I have now or how much knowledge I have now, because it's constantly evolving, constantly changing. And so you have to be ready to learn and be ready to be like, okay, for the benefit of all those that are going to be impacted by my profession in healthcare, I need to make sure that I am constantly learning and I'm constantly pursuing more knowledge so that I can give the best to everybody else. So I think definitely a lifelong learner, and then compassion, because I feel like at the end of the day, healthcare is a hard field no matter what you really go into, and there's a large impact. And so because of the pressure and because of how hard it is, you really need to have that drive and motivation to really care about other people that you're going to help in the future. So I think that heart of compassion to really just like push through the hard days is what you really need. Yeah.
It's really good. Yeah, it was interesting. Christy and I were talking a little bit before about how she wants to go into pediatrics, and a lot of feedback she was getting was, well, you can go into pediatrics because you love kids, but you're also going to be working with parents. And so that lifelong learning and compassion sort of goes hand in hand there, of learning new things and staying compassionate to what a parent might be going through, as well as a patient. It's cool. That's a great answer. Megan, what about you? I know you've worked in kind of a variety of healthcare settings and other settings. What do you think it takes to make it?
Yeah, absolutely. I definitely think everything that Christy said was super, super, super great, and definitely want to emphasize that, but also just being flexible. The healthcare industry is super dynamic and it's constantly changing, and you never necessarily know what you're going to expect. And so just being able to be adaptable in your settings. You'll work with a variety of patients, a variety of other providers, a variety of healthcare professionals, and just understanding that you are all there to do the same thing, which is to improve patient care and help the patients. But that setting may change constantly, and just being really adaptable and ready to move forward, in addition to coming from a place of empathy, just like Christy talked about. I think that's so important, that everyone is here to help these patients, and making sure that that is your primary focus and your reminder of why you're doing what you're doing.
Absolutely. Yeah, I think flexibility will serve us well. If COVID has taught us anything, flexibility will serve us well. And something we talked about kind of on a previous panel is how while going to school during this time that is unique to almost any generation, is unique to any generation that's both gone through a pandemic and have done so much online learning, I think your class is especially equipped to be very adaptable and flexible, and that's huge strength. Erin asked a question on YouTube, and I think it's a really good question for both of you, because you're both super driven and have accomplished a lot in your short time here on Earth. Erin asks, what are some steps you can take now to ensure a successful future career? So thinking back, it's your first year. What are some things you did right? What are some things you wish you would have told freshman B all those years ago?
Ooh, that's a good one. I think definitely don't get caught up in the noise. I always tell pre-med students this all the time because I'm proud of this decision. But when everybody was saying, go be a scribe, which I have nothing against scribes at all, I was like, okay, I'll go be a scribe. This is not freshman, I guess. This is like, I think sophomore year. But I was like, okay, everybody said, if you're going into medical school, you have to be a scribe. So I went and I applied to be a scribe, got in, and I was like in my 4th day in, and I hated it. Like, you guys don't understand how much I hated it. Every single aspect of it. Like, it was emergency room scribing, and it was just so fast paced and everything was crazy. And I was just so stressed and I was trying to learn, but I just hated it. And I was like, oh my gosh, I can't go into medical school because I hate scribing. And then it just hit me and I was just like, you know what? If I don't like doing it, that does not mean I'm not going into the profession. That means just I don't like emergency medicine or I don't like scribing or whatever it is. But like, that doesn't mean an end to this. And you know what? I'm going to still go to medical school and still be on the pre-med route, even though I don't have scribing. I'm going to do what I want to do and like be passionate about what I actually do. So I literally quit my 5th or 6th day, which I don't recommend always quitting in your 5th and 6th day, I guess. But I literally quit and everybody was like, you're not going to get into medical school now. How are you going to get your experience? And you're like, it looks really good on your resume and all this stuff. And pretty much everybody does have scribing. And once again, no hate on that. Plenty of people have good experiences, but I did not like it. And I ended up doing things that I loved instead. I found all these, like, I like went to many different meetings and tried out all these organizations. And then I chose a few that I loved. And those few that I loved, I got super involved in. So that, like, to me, it was just like giving my all to a few things. And they were all connected. They were all like things that I was passionate about or things that I realized that I actually loved, even though I never knew before, and things that I just enjoyed, like doing in my free time when I, like, you know, when other people are out having fun and I was like, oh, I do have to do this, but I like doing it, so it's okay. I think I was really proud of younger Christy for just taking that step, that bold move, and just being like, forget what everybody else is saying. I'm gonna do what I want to do. If I get into medical school with doing what I love, then I know it's meant for me. If I don't, then I'll find something else that is exactly where I need to be. So that's what I was glad about.
It's really good. Yeah, I think of course we have to listen to people who have good advice and take that into account. But I think there's also something to be said that can sort of relate back to a previous question, that in healthcare, there's a lot of trusting your gut and being able to trust yourself. And being able to trust yourself to be a healthcare provider, that's a skill that you have to learn. And that's a huge part of that, is that you trusted yourself and it worked out. Here you are. That's awesome. Well, Megan, I have another question here that I think you can probably speak to, and Christy, I'd love to hear what you have to say as well after. This person came through and said, one of my biggest fears about going into medicine, we could probably make that broader, even healthcare, but one of my biggest fears about going into medicine is having to tell someone's family, oh wait, I'm reading the wrong question. Christy, I'm saving that one. I was looking for a different one. Well, we'll ask this one. I'm going to ask it to both of you. One of my biggest fears about going into medicine is having to tell someone's family I couldn't save their loved one, or telling my patient that I can't save them. What are your thoughts on anticipating a situation like that, or dealing with something like that, having to overcome, a pretty significant fear, and something that I feel like is probably pretty common? Either one of you, whoever sort of feels comfortable answering that question. Megan, you want to go for it?
Yeah, of course. It's a really important and a really valid question. I still remember I was actually in scribe training. It was my 2nd or 3rd day. Again, everything that Christy mentioned about scribing, absolutely valid. It is not the only thing that you need to do. I scribed in Phoenix and hated it, and had a very similar experience to what Christy described of the chaoticness and the stress, and ended up finding a much better environment for myself in my hometown, which is why I transitioned and commuted. But it was my 2nd day of scribe training. I was, I think, like 19, and saw my first patient code and unfortunately passed away. And I think it's variable, right? It's a really difficult thing to do, but recognizing it's part of the job, and that they're going to train you and equip you for that through medical school, through your training. And for me as a scribe, it was all of the other healthcare providers around me making sure that I was okay, because it's a heavy moment, but it's part of the job that you take on, and it doesn't detract from you or anybody else. And, not to blame yourself, but it is one of the things you sign up for, and, it's okay. I'll never forget that day. I'll never forget those moments. And every provider takes care of it differently. So I know certain providers that when that happens, they would take 5 minutes and, they would take a deep breath and process it, and then they would come back. Or other providers would wait till the end of their shift and handle it. everyone's going to process those really, really heavy emotions in different ways. But Christy can talk to it more, and all of the providers I talk to is that they cover a lot of that in your training, and that everyone around you is also there to support you as well.
Yeah, no, exactly. They definitely are preparing us for it already in our first 2 years, but I bet, especially when we go out into the field, it'll be a little bit more present of training. But right now we have mental health physicians that are helping walk us through what it's like to really prioritize your mental health in those situations and how to deal with those difficult conversations. And at the end of the day, like Megan said, she worded it really well, but like, yeah, it is kind of part of the job. I think in every job there's going to be the really hard decisions and the really hard things to do, and then the parts and the reasons you do it for. And the reason we do it for is to help. And sometimes our efforts are not going to be enough, and that's not a way to blame yourself at all. That's not an opportunity to just put yourself down in that moment at all. It's part of the process of life, and you just put everything you have into it, and that's all you can do at the end of the day. And so just being proud of the effort you do make is really important in that, and really prioritizing just resting and pausing in that moment, not becoming, I think a lot of people's fear is to become really like numb to it. And I don't think that's the solution at all. I think it's really important to still have that compassion in your heart, but learning how to process it in a healthy way is, I think, something you learn with time. Yeah.
Wow. Thank you guys both for answering that in such a thoughtful way. Appreciate that. Hopefully that answered part of that question. Another resource I would offer is the ASU Center for Mindfulness. Dr. Terry Pipe, who runs that, she was a nurse for a long time. And I think she might be like a literal angel, but she talked earlier, I did an event with her, and she talked about how in between each patient, using that time where she was washing her hands to recenter, be thankful for that patient and mindfulness. And I thought that was really practical advice of being able to reset and be your best person, be the best provider for that next person. But that's a resource I would really recommend even now. And there's a College of Health Solutions alum who works there as well that I could totally get you connected to if anyone's interested in mindfulness and healthcare. Awesome. So here is the question I was thinking of from, I want to say Dyra. Please correct me if I'm wrong. I hate it when people say my name wrong, but they ask, what have been some obstacles that you've had to face to get where you are today? Have you ever questioned your choice? And my guess would be like on some late studying nights, we've all questioned our choices. But Megan, you talked a little bit about your journey. Would you start off and answer this question for us?
It's a very real question. So my thoughts of working in healthcare started when I was a freshman in high school. We had to do a career project, and I researched being a chef and realized that most chefs work even worse hours than physicians sometimes, and they live close to the poverty line. And I was like, I can be a chef on the side, but I can't practice medicine on the side. So that's how I started my thought process that I was going to be a doctor at 13 years old. Ended up working in a family practice office in high school. My biomedical informatics degree was joint with Mayo Clinic, so I started doing research and observational studies there. I did pre-medical scholars through Barrett, scribed, so had a wide variety of experiences. But when I hit my junior year and it was time to study for the MCAT, I hit the, oh my goodness, what are you doing, panic button, and was really confused if being a physician was something I wanted, or if it was something that I just thought I had the expectation from my parents or family or friends, or that I had never looked at any alternative careers. And so one thing I will say that I wish I would have done is been more open to the fact that healthcare is very broad, and that being a doctor is not the only thing you can do in healthcare. And it doesn't mean that you're anything less than or anyone less than if you don't become a physician. Being a physician is a phenomenal career choice. Everyone that gets into school, they become amazing clinicians and practices and providers. But for me, I don't know. I don't know what that experience is like. And so it's been kind of a roller coaster over the last few years of, do I want to do this? Do I not want to do this? But just recognizing that the field is super broad. And so right now I'm currently working on different research opportunities within children's hospitals in Southern California, working on healthcare disparities, especially like Christy had talked about with homeless populations and how that impacts different people, to see if I really just enjoy working on the research side of things, or if I really do want that official capacity of working as a clinician and being the provider for patients. And so you can do either. It doesn't mean you're anything less than, but my journey has been a roller coaster, and I'm sitting right now telling you I don't know, and that's okay. That uncertainty is okay, and it doesn't make you anything less than. And maybe Christy can talk to some experiences, but for me, being pre-med, I felt this overwhelming pressure that I had to always know what I was going to do, and I always had to get straight A's, and I had to be involved in 18,000 things, and if I wasn't, then I was never going to get into medical school, and I wasn't worth anything. And I want you guys to know that isn't the case, and you can do so many other things. And if being a physician is what you end up doing, phenomenal. And if not, that's also phenomenal. It's a very long answer, but yeah.
No, I think that's so good. And I think one thing you point out is, or that you mentioned, is even like we have this idea that the only way to officially contribute to health is like by being a doctor. It is medical school. That's the one thing. And that's not to say that medical school isn't an amazing dream. And of course we all need doctors. There are so many ways to contribute to health with so many different talents that we need to make sure that we're all healthy. I mean, if everyone was a doctor, we wouldn't have researchers, we wouldn't have people in so many other areas. So I think that's so good. And I think both of you kind of talked about too is again, listening to yourself and being able to trust yourself. And I think that's a lot of the college experience is learning. I think this is like a millennial phrase, but adulting. I'm like a hardcore millennial. Anna asks another really good question. And Christy, we were talking a little bit about how you're still having fun in medical school. So like you have friends and a life. But she asks, did you ever struggle at any point to keep up with the curriculum? What did you do to keep your grades up when you needed to be? And Christy and I were talking a little bit about sleep schedule, but maybe you could talk about like how have you managed rigorous curriculum when maybe you thought you couldn't?
Yeah, that's a great question. I will say, I don't know if I'm like the golden child example of grades really, because I really did not get the greatest grades or the greatest GPA. I had a very average GPA, and even in medical school, I had a very, very average grade. And I think maybe I'm supposed to be the poster child for the average people to say like, it is okay to be average. And because I think everybody told me, they were like, you have to get straight A's or you won't get into medical school. Oh, you don't have a 3.99 GPA? Oh my gosh, who do you think you are trying to apply to medical school? And I'm proof to show that you do not have to have that at all, because I literally had the average. And so, yeah, I think to answer your question though, yes, I did struggle at many points, but I had to really look at like why I was struggling. Was I struggling because of like motivation to like get through this course? Was I struggling because like I actually did not like could not wrap my mind around content that I need to go to tutors and like professors about? Because I definitely did that many times. But sometimes I just recognized like, okay, I just don't have enough motivation to study. So how can I change that about myself? How can I, like, especially in medical school, I do that a lot where I'm like, I literally just don't feel like studying. And medical school is like way different than undergrad in that you don't have assignments. You don't have any work. It's just you're studying for the next exam, and you have lectures and you're studying for that next exam. And so it's just all about motivation. It's all about how you can really keep yourself going. And so I would just have to find ways. I constantly am finding ways for myself to really know, okay, this is what really motivates me. Maybe I'll think about like a future patient, and I'll put together kind of a fake patient in my mind and be like, oh, there's this kid and they're struggling with breathing. Okay, now let me walk through this. Or even in OChem, like I'll just like put random things together and make it a little story for myself, even with little like triangle little molecule things, you know, like I'll just make it fun for myself so that I still keep up that motivation. And I think that's just like really important because it's a long journey. And so you need to find ways that really work for yourself to keep yourself going.
It's good. It's really good. Awesome. Jillian has a question that I think is fun and I think we can answer in a fun way. She says, thanks for being here, which I echo. We're so thankful that both of you are so generous to share your time and knowledge. She said, Christy touched a little bit on mental health. What are some things you both personally do to stay grounded, especially in high stress environments? What are things you do for fun? And yeah, Megan, we'll start with you. How do you stay grounded?
Yeah, that is absolutely such a phenomenal question and so important. For me, I think it's a balance. I think I really like to live by the mentality, work hard, play hard. So I work a lot of hours at work. I did a lot of activities and events in school, but doing something for me every once in a while. For me, that's scuba diving. So I started diving when I was 16. And now I'm working towards my instructor certification. So it's kind of like get all of these things done and then you can reward yourself and have fun. But also sometimes that looked like having a bath with candles on a Friday night at like 8 p.m. So it was just definitely super variable. But for me, it was setting those reward points and saying, if you get this done, you can have a reward. And that's been super, super, super helpful for me.
Yeah, that's awesome. For me, it was just learning how to rest and when my brain and body needed a break. So I've been recognizing that a lot more in medical school for sure. I try to give myself like a morning, just like on a Saturday off for myself to just like breathe, to watch some Netflix, mainly The Office, because I'm kind of obsessed. And faith is a really important thing to me. So my friends and I will all get together and just have like worship nights together on days that we just feel super stressed. We'll just all text each other and be like, hey, we just need to unwind. I know there's an exam coming up, but I just need to de-stress. And that's like an awesome way to get friends together or emphasize whatever faith background you have that to keep you grounded. That really helps me a lot. So yeah.
That's good. We talked yesterday too a lot about good food. I think that's necessary. Sometimes food gets shamed in health majors, but sometimes you just need was it Lucky Charms, Megan? Is that your thing? Am I outing you here?
No, yeah. So I was super guilty. So I was a CA all of my other 4 years, as well as living on campus my first year. So the Barrett Dining Hall was my go-to. And there's a 24/7 cereal bar when the dining hall's open. And so I was horrible and I would eat Lucky Charms for dinner maybe like 4 times a week. So mildly unhealthy, but also like the greatest reward, like, you know, the pot of
gold at the end of the rainbow. That's so funny. I was a CA too. That's so fun. Someone asked, which I think this is really a broader question about medical school acceptance that Christy, I think you can share about. They said, I'm getting my CNA currently. Is that helping my chances? So besides that, and so you can answer that, but also what are some things you did to kind of differentiate your application, or did you do anything?
Ooh, I bet CNA would definitely help. I think at the end of the day, experience for sure in the field to just show that you have been exposed to the field and you know what you're getting yourself into. Because I think that's like a question I got asked at like all the medical schools, like whether I was interviewing there or in my applications, is like, how do you know you're prepared for like what the field is? And that's really through experience more than anything, more than hearing about it. And so I just tried to really make sure I was immersed in the field as much as I could. And since for me, it wasn't as a scribe, which show I was in a clinic all the time. I was in the Saturday clinics and then I was involved behind the scenes. And I think that really helped me helped show others, especially like medical schools, that I saw both sides of it. I saw the administration side and I saw the clinical side. And I was able to appreciate that and know that I still wanted to go into that after all that. And I think the most important part of an application overall is having a story. And I think that's really important because I think medical schools have seen millions of applications. And so they're really used to like, oh, they did this, and this just because it looks good kind of thing. But when you actually have a story to tell through your application to show like this is what I care about, and this is all the things I did that really align with what I care about ultimately, I think that's the most important thing. So for me, kids and the underserved and social determinants of health were like my 3 big themes in my application. So everything I did was somehow related to that. So show was related to underserved populations, and my thesis I did on social determinants of health, and I was involved in Athletes for Life research, which was with kids, and then I did Muscular Dystrophy Association. I was a camp counselor over the summers, so that was with kids that were underserved with disabilities. So all those ways, I'm just like listing out things, sorry, but like I'm just trying to show that all these different parts of my application were all connected. And whenever they asked me about any part of it, it was clear that I was passionate about it, and I wasn't doing it because it looked good. It was because I really cared about that population, or I really cared about what I was working towards. And medical schools can tell. Medical schools can, like, they're just, they've read so many applications that they can tell when you care about something versus when you're doing it because that's what looks good. So I think at the end of the day, do what you actually love and pursue it wholeheartedly. So yeah.
Okay, I feel exhausted listening to that list, but that's pretty cool. A lot of people are asking questions about getting involved, how you find organizations, what sort of things you got connected to, how did you find these resources, whether that's student organization, resource, lots of things, or jobs. How did you guys find those? I'll let you both answer.
I actually use the pre-health advisors a lot. So they were my best friends. I went in all the time and was just like, okay, what opportunities are there? And then they would list out a ton to me based off of like my personality and what I was looking for. And then they would be like, okay, try these out. And so I would go to different clubs and I would try them out. And then I would be like, okay, didn't like this, like this, like this, you know? And I would kind of like narrow my options like that. Yeah, pre-health advisors, and then your professors. Your professors know a lot of things going on behind the scenes. And if you make connections with them, they'll be like, hey, I just heard about this cool opportunity that's going on. Maybe get involved with that. And it's a really cool way. That's how I got most of my research opportunities, was just like talking to professors, not to really get anything out of it. I was just talking to them because I was like, oh, I enjoy talking to you about healthcare. And then they were like, oh, you like this stuff? Let me tell you about this research. You can join me in. I'm like, okay, sure. No.
Cool. Yeah, absolutely. I think I'm so glad you said that, because I think sometimes it can be really intimidating to approach faculty, especially your first year. And maybe that's like a benefit, a silver lining of being online, so you can shoot the email over to them. But the fact of the matter is they're passionate about this and want to talk about it. Megan, you want to share a little bit about your experience, your extracurricular experiences in school, whether that was staying connected with classmates, research, things like that, and how you kind of came across opportunities or took them?
Yeah, absolutely. So I was involved in research, so very similar to what Christy said, is just going up to professors and talking to them, asking about opportunities. I was fortunate that my degree program is very, very, very small. So I had very close working relationships with all of my faculty members. I ended up starting research as a second semester freshman and stayed with those research advisors all the way through my +1 year of my 4+1. So I've worked with them for the last 5 years, still email them on a regular basis, check in how they're doing. We send cookies back and forth. Goes to show you that like research mentors and advisors are not always just there to benefit you for your research, but also can be invested in your personal life and can help mold you into being a better student, a better advocate in your community, and cannot speak highly enough about that experience. But in addition, I would just say try new things. And so as a freshman, I randomly joined the synchronized swimming team. I've never done synchronized swimming. I swam and I did gymnastics, but I was like, synchronized swim, sure, I can do this. So you can definitely try super random oddball activities that you wouldn't normally. I understand in today's day and age with the global pandemic happening, that looks a little different and can't fully speak to that experience, but just recognizing that try something that's super non-traditional or that you're just curious about. you never know what's going to happen. I ended up realizing that I couldn't do synchronized swimming to save my life. I couldn't be upside down and swim very well, but I tried and had a wonderful experience shivering in the pool in, February, as well as just getting involved on campus. So I gave campus tours as a devil's advocate and as an honor shovel for Barrett. And so learning about different activities or organizations through other people that I was involved with, and really just getting to see what they were passionate and interested about. So if you're interested in chocolate, join a chocolate club. Or if you're super interested in research or getting super involved in the community like Christy talked about, utilize those organizations, but just recognizing that there are so many opportunities for you at ASU and the greater Phoenix community. And that was one of the reasons why I chose to go to school where we're all going to school.
I was devil's advocate too. Are we the same person? So exciting. I loved it. It was a great way to get involved. That's so good. I think too, what both of you are saying is there's really no cookie cutter way to go through your experience. And if you can be an advocate for yourself and your education and what you want and be that squeaky wheel of the person who's talking to faculty, who's connecting with advisors, people really do want to help you. And there are a lot of resources. Sometimes it's just getting over the hump to ask for them, but they're certainly there. A lot of people are asking a question in kind of a similar vein. This question in particular says, how can one build relationships with professors, and asks, oh, wait, that's not the question. These keep scrolling. Goodness. Really, a lot of people are asking about getting yourself out there. So like getting this medical experience. You guys are just asking so many questions. The questions are scrolling. It's awesome. But really this daunting task of, here I am, I signed up for a major. I know I want to help people feel better. How do I get these volunteer hours? How do I get myself out there? How do I insert myself in the medical field? What if I start as a scribe and hate it after 5 days? What would you say to someone who said that? Go for it, Christy. Yeah.
Okay.
Well, you're pretty good at inserting yourself, but maybe you can train us.
I do sometimes put myself a little bit too much out there, but I think it's just I don't know, not being afraid to really, like, I think people get so afraid to, like, what will other people think kind of thing, or like, oh, everybody else has probably asked this professor this, so I shouldn't be the 10th one to ask. And I think I've thought that so many times, and then like asked a professor anyway, and then be like, oh, nobody's even asked me about this yet. And I'm like, what? Like, I remember I went to a College of Health Solutions panel with all these, like, there was like a PA and a doctor and all this stuff. And I was just like, you know what? I'm just going to take a risk right now and go up. That was the time when I was really interested in PA, actually. And I was like, okay, I'm just going to go up there and just talk to the PA and maybe ask if I could shadow him, even though they had never mentioned that at all or anything like that. And I was just like, I'm just going to ask. I've never shadowed anybody before. This is literally my freshman year. And I was like, I don't even know how to do this. I don't know any PA or doctor to shadow. And so I'm just going to ask this random guy. He seems cool. I'm just going to go up. I bet 10 million people have already asked him. And I go up. This is like already the end of the session. Like everybody, I was like last in line. And I was like, hi. Like, and I said some information about myself. And then I said, is there any time that I could shadow you? And he was just like, oh, nobody's ever shadowed me before. Yeah, you want to come in next week? And I was just like, are you kidding me? Like, wait, nobody asked you? Oh, okay, there was like a line of like 25 people and nobody did that, and nobody's ever asked to shadow you? What? So I literally got to go in. It was like right before Thanksgiving or something, and I literally got to go in Thanksgiving week with him in the urgent care, got to shadow him. It was super, super cool. And he was just like a really cool guy. And he just talked all about his life and why he got into PA and all this stuff. And it gave me so much like perspective. And I never knew that all I had to do was just actually be brave enough to ask in my freshman year and just ask this PA who I thought had plenty of people going after him to just ask if I could shadow him. Because I think at the end of the day, you need to have that perspective that people want to help you. If they're coming to these sessions, if they're a professor, if in whatever it is, and in general, people want to help. And that's why me and Megan and Katie are here. We just all want to help you. So I think just having that perspective that you're not an annoyance, you're not a bother, ask, and you'd never know what will come out of it.
So good. Megan, I want to hear about, I know you have good things to say about advocating for yourself and creating opportunities, but I want to, because you mentioned PAs, Christy, someone asked about like what we thought about being a PA, and my background is not in healthcare, but what I would say about anyone who was like, should I be this or this? It depends on the person and what you're looking for, and all things are, lots of things are valid and lovely career choices. But what sort of tipped the scale for you on PA, just against it, just while we're here?
Yeah, while we're here, I think the main thing was having the autonomy. For me personally, I want to go into things like the mission field and kind of do my own thing afterwards with healthcare leadership, actually, and healthcare administration. So with all that and the ways I want to get involved, it requires a lot of autonomy. And as a PA, you do have to be underneath a doctor for everything, for signing and for going off. It requires a lot of like physician oversight. And so with what I wanted to do, I just figured that it was best for me to actually go the full way and become a doctor. But many PAs just think that it is a shorter amount of time. You do have a lot more flexibility in terms of which specialty to choose. So there's a lot of advantage in that as well. And then there's less liability. So those are definitely advantages of PA over doctor. But for me, I thought it was best to just have that autonomy and just specialize as well. Yeah. Short answer, but.
That's awesome. Just while we're here. Okay, so Megan, we're going to bounce back to you. You ended up commuting back and forth because you had a job that you felt really connected to. But I know there are lots of other things that you did. You want to talk a little bit about what it looked like for you to make your way in healthcare and how you kind of got your feet wet, got yourself out there?
Yeah, I mean, I can emphasize again what Christy said. She's full of wonderful, wonderful advice, is just put yourself out there because you never know what's going to happen. I think a lot of us get really, really nervous and psych ourselves out before we ever get started. It's like, oh my goodness, this person will never want to talk to me. I'm just a low freshman, or I don't know what I'm doing. But everybody starts somewhere, and everybody who's super advanced in their careers also started at that point somewhere as well. And so people are really willing to help you, but you have to be willing to put yourself out there and potentially face that fear of rejection. And if for some reason somebody says, no, you can't shadow me right now, or no, my research lab is full, don't take that personally. Just take it as this wasn't the right step for me. As far as getting involved in healthcare, I was super fortunate to have a mom who works in pharmacy. And so I kind of knew a little bit about the hospital life because she was a pharmacist in a hospital. But particularly, I knew I wanted to do research within healthcare. And so that's particularly what I went after. And again, I mentioned, so the biomedical informatics program is joint with Mayo Clinic. So we actually have offices at Mayo Clinic, and I was able to do shadow rotations in different departments and ambulatory care clinics, outpatient care clinics, all at Mayo Clinic as part of my course curriculum. So as classes, it was requirements for me to go shadow in these programs and observe. So kind of, it seems like a very roundabout answer, but you'd be surprised at how many opportunities your coursework can afford you to get involved, as well as just putting yourself out there and not being afraid of rejection, whether it's going to be for a research opportunity, whether it's joining an organization, whether it's just, having fun and doing something with new people. But you never know what's going to happen if you don't try. And if you don't try, the answer is no. But if you try, the answer could be yes.
It's really, really, really good. I love that. There are a lot of really specific questions about hours and what things look like with applications. Those are all really great questions for a pre-health advisor. That's their whole job, is to help make sure that you are connected to the resources that you need to get those things done. Christy, you want to talk a little bit about your experience with pre-health advising and how that was useful to you?
Yeah, for sure. I just started by just emailing. I was just like, hey, I don't know what I'm doing at all. I don't know anybody else that's in medical school. I've heard of a lot of people in pre-med, but I don't know what to do. So my pre-health advisor literally just started me off in square one, and we just met together. We talked about why I wanted to go to medical school, what I like wanted to do throughout my few years at ASU and specifically, and then ways that I wanted to get involved. And so she helped walk me through each step of that process, got me connected to resources, got me connected to a doctor I could shadow. So that's actually how I even got exposed to the DO field, was I got to shadow a DO, and it was literally through my pre-health advisor. She was just like, oh, we heard about this random physician that is willing to let people shadow him. And I was like, me. And so just by talking to her, she connected me like that, which was awesome. And yeah, I just walked through. I just constantly, I would keep up to date with her about experiences that I was having with these different things. I told her about the time when I quit scribing, and she was like, all right, new plan for that, you know? And so we would just walk through each step of that process. But I would probably meet with her about like once a month, I would say, just to keep up to date about like where I'm at and where I want to go with things. And so I just think it's important to just have a good relationship, because I think if you just email them every once in a while, it's fine. But having that consistent relationship with them really, it actually helps you more, because they're able to really cater to your needs and find opportunities specifically for you.
So good. Yeah, absolutely. Again, there to help, and I think can speak to really specific situations of, this is what I'm wondering, this is what I'm doing.
Yeah. Another really cool thing they did was do mock interviews for me. So literally the whole pre-health panel, all the advisors, they like, I think there was 3 of them. They got together and then they walked me through a fake medical school interview, which was really, really cool. So they have a lot of cool resources that they're able to help you out with.
So cool. It's awesome. Well, we have just a couple minutes left, but Megan, I would love for you to share a little bit. I think this is just really important. Your experience, your office experience when dipping your toe in the medical field, and kind of how that might be kind of beneficial when you're looking for experience. I feel like you talk a lot about taking those opportunities to learn. Like she was like, I was a file girl. But I think it's really so much more than files. It's learning a lot more. I wonder if you could talk a little bit about that.
Yeah, so in high school, I was talking with Katie yesterday. So in high school, when I worked in the family practice office, I was, quote, the little file girl. I mean, I would literally go after school. This was back before electronic medical records were enforced and were as standard practice. So we still had paper charts, and I would get the patient records and I would get hospital records and I would file them into their charts in these giant cabinets that are like 10 feet tall. And I would have a step stool that I had to go find different files on, and they would spin around. And I'd be the person that would call you and remind you of your appointment on Monday, the 24th at 9 a.m. And so all of these were super simple tasks that I was like, oh, I'm just the file girl. But recognizing later on in my own career, my courses, or in my hospital experience, that every single part of the medical care team is a crucial part. Like healthcare providers couldn't do what they do without simple people like file people or patient reminders or administration people that check you into the hospital, or security guards that monitor the premises, that everyone works together. And so don't overestimate the role or a position that you may have. You may not be in this super fantastic, cool area where you're watching surgeries happen every day and you are working firsthand with like blood squirting, and your life may not be a Grey's Anatomy scene, is what I guess I'm trying to say. But that doesn't mean that it's not important and it's not critical. And so even super simple hospital experiences or healthcare experiences that you think aren't important can be critical to your understanding of the field, but also you can leverage that if you are applying later on to any healthcare profession, whether it's PT school or medical school, and say, I was here and I saw the importance of this, and I was the low man on the totem pole once. And so later, when you are that healthcare provider at the top of the totem pole, you remember that and you can practice that empathy and be a better provider overall. So, a 16-year-old filing paperwork, can now speak on that experience much more fondly than when I was filing papers. But don't overlook the importance of even small roles in the healthcare field.
Really good. Yeah, Christy, I love the snaps. Would you agree? I just thought that was so.
That was wisdom. You guys all need to listen to that. That was good. That was good.
I just think it's so important because it's all about that patient experience, and if you don't know the other steps to that, it can only help you, whatever your role is in the healthcare system, to understand what the patient is going through in other areas. And so you might think you're just a file girl, and really that information is going to pay off for you later on. And it's an investment in the future, in those people you're serving then, and their health, and the people that you'll serve in the future. All right, well, we just have a couple minutes left, so we're going to do one more question. Both of your answers have just been so rich and so practical and good. If you had one thing that you could say, maybe looking back on your undergraduate career where maybe you didn't think you were going to make it, or it was going to be hard or whatever, what's one thing you would say to encourage that person, to tell them to keep going?
Oh,
why is it worthwhile?
I think just knowing who you're doing it for and always having that in perspective. I don't think I mentioned this part of my story, but I was like, I wanted to be gung-ho. I was gung-ho medical school all my life until like junior year maybe of undergrad. And I was like, nah, I'm just gonna be in the healthcare administration field. And I had completely changed my mind, and I was like, nah, I'm good on medical school. And I was just like, because I saw the impact of that, and that's what I wanted to do. And I ended up having a moment where I was just like, I was shadowing a DO, and I just saw that effect of patient care on a patient's life. And I just saw myself in that position. And I saw myself being able to help that person that was in pain. And in that moment, being that source of hope, being that source of compassion, and being able to help actually physically with my own two hands and with medications and whatever it is. And that, like, imagining that and envisioning that was what really took me back to medical school, and was just like, this is where I want to be. And that could be for anything. It doesn't have to be to be a doctor. It could be to be in healthcare administration, or a PT, or a PA, or whatever it is, or a researcher. But just imagining yourself in that position and being like, that's the impact I want to make on the future of the world. I think that's what encourages me every single time whenever I have my hard days, to be like, yeah, that's who I'm going to help one day. That's who I'm going to impact. And that's the legacy I'm going to leave. So yeah, I think just always having that perspective and having that moment you can look back on. I think that's really, really important.
It's good. It's really good. Yeah, we've got to hold on to those moments. Megan, what about you? What would you say to Lucky Charms eating Megan in the dining hall? Tell her to keep going.
I think there's a few things. I think one, be kind to yourself. Somebody said that to me the very first day I arrived in Malaysia on January 1st this year when I flew into the country, and it's just be kind to yourself. If you can't take care of yourself and be there for you, you're not going to be able to put your best foot forward in your classes, in your extracurriculars, in your personal life, until you're there for you. And so self-care, mental health is super important. And, it's one class. Like, if you fail one exam, I failed my very first Gen Chem 113 exam, got a 54%. I will never forget it. I got an A in the rest of the class. It was okay. I cried to my parents for probably 30 minutes, and they're like, oh my gosh, is she going to be okay? But, it's okay. Be nice to yourself. Everything's going to work out. But also just don't pigeonhole yourself. I was so focused on only being a physician that I missed out on so many opportunities and experiences to try new things. I didn't really take a bunch of classes that explored my interests or my passions outside of the pre-med field. And it's something now post-grad that I look back on that I wish, I wish I would have tried these out and saw that there were other options. Just because I take a class in a different field, say I would never take an English class, but if you're really interested in English, maybe take an English class. And say, at least I got to experience this, test it out, and try it. That's the beauty of being in school right now. Once you graduate, if you want to try and go back, I don't know if Christy can talk about it, but school is really expensive. And even just being interested in trying to take a fun class, it's like, pay me $3,000. And I'm like, what? So take advantage of those opportunities while you're in school and try everything that you're interested in, including all of those pre-med classes.
Yeah, I just to add on to that, just say like totally that. Just enjoy your life, because I think everybody gets so caught up in like, oh, I'll enjoy once I become a doctor, or once I become like get my job, or once I'm out of undergrad or whatever. That time will never come. You gotta appreciate every single moment. Like, I wish I enjoyed undergrad more than I did when I actually had way more time, but I thought I had no time. Little do we know. And now I'm sitting here in medical school, and people that graduated are telling me, enjoy your time now, you don't get time later. And I'm like, whoa, what? But it just goes to show, like, every single season you have the ability to make time for yourself. You have the ability to enjoy the friends around you, to really try new things, do whatever, but enjoy your life. It's not like, I think a lot of people just look at the next season and say, I'll do more then, and that will never come. So really take time for yourself, enjoy yourself, and enjoy your experiences.
It's awesome. Absolutely. Absolutely. And I think Megan, that's so wise to be kind to ourselves, that if we aren't enjoying our lives, if we aren't being kind to ourselves, how could we expect to extend that to the people that we're serving? So important. Well, we are right at our time, but wow, thank you guys both so much for sharing so much good information. Lots of people want to stay connected with the two of you, so I hope that's okay. We're going to send lots of people your way, and I'm just super thankful. We hope that everyone will join us for our next panel on the 29th, which I dropped that information in the chat. But otherwise, hope everyone who joined us today had a great day. And again, thank you so much, Christy and Megan. Really appreciate it. We'll talk to you guys later. Bye-bye. Oh, you're welcome.